thank you for joining us. Empowering Voices, as you know, is your television program. We always have special, unique guests. We really do, don't we, Morris?
Yes, we do.
And Morris Adams is my co-host, and he is just wonderful. He has all those wonderful questions so that we can provide you, the viewer at home, an amazing program. Our doctor today is the wonderful Dr. Clifford Eke, but he's got a name, Chimaobi boy. How do you say it, doctor?
Chimaobi.
Chimaobi. And does
Yes.
it have a meaning, doctor?
It has actually meaning and a story behind it.
Oh,
It
tell
means
me.
it
Can
means
you
God
mind?
knows our heart,
Yes.
literally. G is
Uh-huh.
God, Ma is no, Obi, heart. God knows our heart.
Ah,
And
beautiful.
yes, my parents named me that. They had 5 girls before me.
Uh-huh.
I'll make the story brief. And
Yes.
in our culture, it's a big deal, boy who carry the family name, all that stuff.
Yes.
So they were pressuring my dad to actually remarry so he can find someone to have him a boy. But my dad was educated and knew that the boy comes from the man, the Y
Yes.
chromosome.
Uh-huh.
So he didn't remarry, obviously. Eventually, I came along, and so they said, oh, people started changing their story. And he says, no, Chimaobi, God knows your heart. God knows our thoughts.
Beautiful.
Yeah, thank you.
Beautiful. Now, isn't there a town also named very similar?
Yes, there's a town, Chima and other things, yeah, but not the full name, yes.
Yes.
Yeah.
Yes, I was noticing that as I read a little story, about Nigeria. Yeah. And Morris, you had a question. We're going to start off with Morris, our co-host, who is going to ask you our first question. Okay.
Dr. Eke, I'm going to ask the question, but I'm going to preface it with a statement. I was working at the prison in the medical area, and there was a young man. He was so excited. He was just ecstatic about his vacation. And so I asked him where he was going, and he said he was going to go with Doctors with Borders. And I said, what do you do? And he kind of described it for me. And I thought to myself, if I had a vacation, would I do that? So I'm going to say this. So this question for you, can you do this for us? Can you describe for someone sitting out there who's never come in contact with Doctors with Borders, can you give us a picture of what it is that you're doing? And then that way we can help other people know why this gentleman was so excited to spend time with Doctors with Borders. Could you help us with that, Doctor?
Is it Doctors Without Borders or is it Doctors with Borders?
Without.
Without Borders. That's what he
Yes.
said. Doctors Without Borders. Yes.
Okay.
Yes.
Good.
Yeah,
Thank
Dr.
you. First, before I answer, I want to thank you, Morris, Mr. Morris Adams, and Ms. Erlinda Patterson for your show, Empowering Voices, and for making what we do known. So, but to answer your question, Morris, Doctors Without Borders has been around for years, over 50 years, before, doing work in different parts of the world, usually where there is poverty, insecurity, things like that. I support them actually financially. I make donations to them. And they were the inspiration for me to have my own volunteer activities, which is why I formed Chima Medical Missions International, which is a nonprofit organization. And we do similar things like them, but in a smaller scale, whereby we go to Nigeria annually. We also been to Mexico, been to Guatemala, been to Honduras with different organizations, and provide free medical and surgical care to the underprivileged. So the guy you met in jail is so excited because, we take things for granted. We're here in the US. We're so blessed,
Yes.
You and I are talking, we have light, 24 hours.
Water in the sink.
Clean water.
Yes.
We have food. We have clothing.
Yes.
So we take things for granted, but we are so blessed.
Yes.
That when you go to most parts of the world, those are luxuries. People can barely eat
Mhm.
one meal a day. The light in Nigeria, I can tell you, if we have light for 4 hours a day, we're excited. So, and then medical care is almost, is not very well. If you have money, yes, you get great care. But if you don't have money, then you don't. And we feel like health, access to health should actually be a right, not just a privilege of every human being. Because of that, now, if we can go and touch one or two or more lives and make them better, give them hope, that is the satisfaction. That's the passion. That's why the guy you saw in jail is so excited to go and
Yes.
join a group like Doctors Without Borders, or a group like
Yes.
mine, or a group like other nonprofits that go to
Yes.
different parts of the world to help
Yes.
people. Yes.
It's a
So,
total blessing
yes.
that you give part of your life. You know, it's a gift that you're giving to that individual who is getting that treatment. You're saving a life, quite frankly.
Yes.
You know that. You know, you are, gosh, Dr. Cliff Eke, and you work at Kaiser Permanente, correct?
Correct.
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 And there was a doctor there once, Flores, Dr. Flores. Do you remember him?
Yes, the
He used to
anesthesiologist.
do, yeah,
Anesthesiologist, right?
yes,
Yes, Doc Flores. In fact, I've been to mission with him in Mexico.
yes,
Yes,
you
he used to do similar
have.
thing
And I
with,
think his wife was also part of that.
that's right,
He
because she was a
married
nurse
someone from
anesthetist.
Kaiser.
That's right.
Yes,
We all went before, yes. We used to
yes,
go
and
with Interface.
they were so excited to go out there and give of themselves.
Yes.
You know, I know that over there they don't have, you know, the 4x4s. They don't have the injections, the needles. They don't have all these things that we, you know, let expire.
Yep. Right
They
on.
expire by the cases,
Yes.
not just a few syringes. I
A
mean,
whole
I've
bunch.
seen doctors take these things to other countries
Yes.
to help.
And put them to good use.
Yes.
Now, you brought a point out that was, it's a real big flag. You said you do this service for free. That again is amazing. That says something about your heart. But now these countries, are they allowing you to come in? Are they welcoming you? Are they putting up resistance? Tell us about how is it that you go from this country to that country, and are there any challenges? How's it work?
Oh, yes. Good, very good question. So usually before I go anywhere, we have to have a local partner. Very important. Because even though we go once, twice a year, we need somebody on the ground that hopefully can continue to continuity of care that can keep it up.
Mhm.
So before I go anywhere, we always have a partner. Then we do what we call needs assessment. We ask our partner in this certain area in the town, what do you need? Do you need certain types of surgical specialties, medical specialties, etc.? And then based on that need, we recruit volunteers here in those specialties. And then we also tell them to recruit local physicians and nurses to work with us in partnership. Because not just do we want to help the people, the patients directly, we also want to do training and share knowledge and skills
Yes.
with the local
definitely.
providers there. And interestingly, we also learn from them. You know, it's not just us going to teach them, but you know, they're in a resource scarce environment. So they tend to do some things very well that we don't even do here. So I learn from them too. And you know, observe how they can work in this resource scarce environment and still be effective. So it's a team effort. So the team from here volunteers and the team there volunteers, we get together, then we choose a date. And then before we go, they screen the patients and make announcements for the patients to come. And then when we go there, we work together, different aspects. Now, there are some challenges, lots of challenges.
Of course there are. Yes.
Depends where you go. In Nigeria, it's not too much challenge for me because I'm from there and English is a second language.
Yes.
When I go to my village, I speak my language, Igbo language. So, but if I went to Honduras or Mexico, I don't speak too much Spanish. I speak Spanglish, I would say.
Yeah.
So you need interpreters, for example, you know.
Yes.
we need security. In some of these countries, it's not very secure. So we actually hire security locally to protect us and then get the local people involved. And sometimes even the local people, we give them some little encouragement or stipend to take time off to help us.
Mhm.
Yes.
Wow, that's fascinating. Now I got to move to another question here. You covered a lot of the questions that I have inside me, but here's another one. Okay, now you did this wonderful job. Fantastic. Everybody's excited. I'm excited. You're excited. They're excited. The appreciation that does anybody, have you ever got a case where somebody reached back and said, thank you for what you did? I mean, is it a thankless job or is it, do you get the appreciation?
Wow, that's very, very good. First of all, to me, it's priceless.
Thank you. Yes.
Priceless.
Yes.
When I go, I mean,
Yes.
there's challenges, like I told you, no light, the water, we got to make a bunch of stuff. But when you touch one life, I'll give you several of them, good reports. One patient was in his 50s, actually, and he had a huge hernia. Hernia, you and I will get here, we have insurance.
Yes.
We go get it fixed, within a few months, right? But he's had it for 10 years because he didn't have money to get it fixed. And this hernia was all the way, like halfway down to his thigh, very large. So we showed up and he had, it was a free surgery, which I was doing. And there, usually we use like epidural or spinal anesthesia, we numb through the back because we don't have too many general anesthesia equipment. So as I'm doing the surgery, normally a hernia would take me less than an hour to do here, regular size hernia. His took me 3 hours because it was so huge. So as I'm finishing, he started crying. After a while, they told him, oh, hang in there. The nurses were talking to him. And he started crying when they told him, oh, we're almost done. So I thought he was having pain. So I was asking for them to give me some local anesthetic so I can inject. And he said, no, he's not in pain. I said, why are you crying? He said, oh, you guys, this is tears of joy. You're giving me a new hope in life because 10 years ago, since I lost my wife, yes, I lost my wife. I got this 10 years ago. I was too embarrassed to even date or meet another woman. That's one. Two, I was embarrassed and I couldn't get a job because of the hernia. I failed all my physical.
Yes.
But now I can go get a job and I can get, meet somebody and have a life.
Have
so that's
a
just
life.
one of many exciting. Yes, that's
now,
priceless.
Tell me, I was going to call you Pastor.
Well, we do that too. We do that too, by the way.
I know
Erlinda.
you do.
Yes.
That's part of it. I know that you do. I know that you do. What has been the hardest surgery you've had to do that, kind of left you worried about that particular patient over there? Have you had
hardest surgeries? It has to do with cancer, usually.
Yes.
Because sometimes we go there, for example, I take breast cancer, for example.
Yes.
Here we have mammograms. We emphasize screening, which is very important. You find it early, you take care of it. But there we don't have screening techniques or modalities as well as we have here. And even where they exist, the people in the rural areas and the villages cannot afford it.
Right.
So when they present very late. So then I go there, I know I do the much I can to at least take care of the cancer. In this case, breast cancer that's going through the skin is very involved. And I know it's advanced. This patient needs chemotherapy afterwards. However, we don't have a lot of medical oncologists in Nigeria specifically. And it costs money.
The money, it would be unaffordable for them.
Unaffordable.
Yes.
So sometimes what we've done is, at least I know in one situation I had to pay for the chemotherapy, for the person to get it. But that's just, there are so many of them.
Yes.
And that's what breaks my heart, is the healthcare system is not as robust as it should be. So some of the things we started doing when we start doing seeing this is advocacy. We're doing a lot of advocacy when we go. I work also with a group called the Association of Nigerian Physicians in the Americas. All the Nigerian doctors here, we have a group. So when we go now, not only do we do the mission, we travel to the capital, Abuja. It's like going to Washington, D.C. in this case,
Yes.
right? And lobby and advocate for healthcare improvement so
Now,
that people can get insurance.
you covered another area and you did it well. So I won't ask the question. I'll say thank you, because it's not that you want to work yourself out of a job, but at some point in time, you want what you're doing to take root so that it grows into a big tree. Yes.
Yes.
So the government can take hold of it.
That's right.
Now I'm going to ask you another question. I think
Actually, sorry to interrupt you. If we're out of job, my goal, I tell people this, okay, my dream is when medical mission will be unnecessary.
Yes.
Or even
Yes.
million, you know, or with technology like I'm talking to you now, we can actually help remotely.
Okay.
We did actually
Yes,
this year.
you talked about that.
I'll let you ask your question. We'll come back to that.
Yes,
Okay.
please.
We want to come back to the remote.
Yes,
helping remote.
the
But I want to ask,
virtual surgery.
yeah. Before you go there, I want to ask one question. The pandemic came in, it stood up, and it doesn't want to sit down. It's a very bad child. It doesn't want to behave. How has it affected what you do? And have you incorporated mechanisms or technology to overcome what it's doing in the area? How has the pandemic affected what you do?
Good, great question. Actually, in 2020, the Association of Nigerian Physicians, which I'm part of, and actually I was the chair of their medical mission, we plan to go to a part of Nigeria, Calabar, in April of last year. But then on March 11th, as you know, the World Health Organization declared the pandemic.
Right.
Yes.
We canceled. And then we thought, well, let's reschedule it for 2021 this year, right? Lo and behold, most people have not been vaccinated.
Mm.
And, you know, COVID is still going on. It's the baby that doesn't want to sit down, like you said, right? Yeah. And I want to use this, let me use this as an opportunity to please encourage our people to get vaccinated.
Right.
Please. I want to plead to our audience, especially folks like you and I,
Yes.
you know, Hispanics, African Americans, minorities, we are those that have the highest death rate from this. So please, everybody get vaccinated. I have, and I still have 2 eyes and 2 ears and nothing crazy.
And I do too. And I
Exactly.
got vaccinated.
Nobody's tracking you. There's no anything in the vaccine.
No.
You know, the container of the vaccine, yes, was tracked so people don't steal it, but not the actual vaccine. And the technology is safe. People tell me, well, it's not been tested. I tell people, listen, our cell phone that we have now, before we used to have flip phones, remember?
Yes.
And it took forever. Then all of a sudden, Apple and all these guys gave us
just talk to it.
And we just changed. The same thing. This vaccine is a smartphone or the smart vaccine of vaccines. It doesn't have to take years like it used to be. Please.
Yes.
Let's protect ourselves.
Let's protect ourselves and those that we love.
And those that we love. Yeah. If we need to wear masks temporarily, let's do it. If we get enough vaccination, we don't have to wear masks anymore.
And you're right, doctor, because, you know, a lot of people say, oh, no, I don't want to do this. I don't want to do it. And they don't worry about the fact that it could be their grandchild.
Yep.
The grandma. It could be someone they love.
Yep. And I've lost people. I've lost 2 very good friends and my brother-in-law to COVID.
Yes.
Before the vaccine came.
Yes.
So I want to encourage us to please do it. And when we do it, we can get over this, you know, this pandemic. Now, going back to your question, Maurice, I didn't forget it. I wanted to use this as a plug-in to help our people.
And thank you so much.
Thank you. So this time now, April came around of this year and we couldn't go again. So we felt bad. I said, how can we cancel the same city twice? So I asked our president of our organization, I said, why don't we try a virtual mission? Let's adapt. Because here at Kaiser, where I worked, since the pandemic, we learned that we can use videos, we can use telephone, we can use technology to leverage and take care of patients.
Yes.
And then he said, oh, well, let's try it. So I have a friend who is also into technology here in Orange County,
Mhm.
Mr. Amadou Diallo, and he was able to build us a custom telehealth cloud-based platform, almost like this Zoom that we're doing now,
Yes.
that we were able to use. Along with Zoom, we also use Zoom for our preparation. We use WhatsApp and different other social media platforms to then perform virtual medical mission. Of course, again, we have a local partner and volunteers. We had about 100 volunteers in Calabar, Nigeria. There was about 45 of us here. And we had series of meetings like we're having now to plan everything. And then we bought drugs locally there. In fact, we even sent COVID tests from here for the people to be tested. And we maintained social distancing or physical distancing. Patients registered online before. Instead of coming physically, they register online, they're given times when to come. And then they get tested. Every patient that had surgery got tested, just like we do here. And then our local partner surgeons perform the surgery. And then if there's any question they have, the surgeons like me are available over Zoom like this to talk with them before, during, or after the surgery. That was the toughest part, was the surgical part. But we also had medical, where the doctors took care of patients, and then we can also have a debrief, afterwards. And the difficult patients, then the consultants here can see them afterwards. So It was fascinating. Never been done before. Never. This is the first time in the world that this many people with different specialties, pharmacists, nurses, doctors of different specialties, put it together. So we are writing it up to hopefully share with the world that it can be done.
Well, it is the first time in the world that it's been done, but after all, I mean, Dr. Clifford Eke is working on it. So it's going to happen. I mean, come on.
Thank you.
You've done an amazing job. You also were the president of the American Cancer Society. Is that right?
Yes, I was. Yes.
You had a leadership there, right?
Yes.
What type of work did you do there?
Oh, yeah. In 2011 to 2012, I volunteered for the American Cancer Society. I'm still a volunteer, but I held this leadership position as president of the California division. And I was impressed to go against cancer, is one of the big things, which we need to get rid of. Also, tobacco.
Yes.
Tobacco is the leading cause of preventable death worldwide. And so that, we did a lot of advocacy. In fact, the Proposition 29, if you remember,
yes,
I was one of the authors of that proposition to increase tax on tobacco. It failed, but eventually we were able to pass it, I think, Proposition 86, about 3 or 4 years later on, with persistency.
Yes.
So medical care doesn't just mean taking care of disease. I think prevention is very important.
Okay.
In the past, people used to smoke in the airplane, for example.
Yeah.
In the restaurants and all that stuff,
Yeah.
The American Cancer Society, American Heart Association, American Lung Association, we partnered with other stakeholders to put pressure on the government and our lawmakers to make laws that prohibited tobacco and smoking in these areas. So we've come a long way, but it's not done yet. There's a lot of work still, because now they're getting our kids with flavored tobacco products.
Yeah.
Oh, yes, the vaping thing.
Terrible.
Fighting still.
Yeah. Yeah. They're putting what flavors and silly little names. And, the little kids, 13, 14-year-olds think that they're hot. They're big,
That's right.
hot stuff now.
Yeah, but they all have nicotine. So they want to get them addicted early. And once they're addicted early, they become lifelong customers of tobacco products, which is the only product that, when used as directed, kills you. Think about that.
I want to work on one more part of my picture. You drew a really fantastic picture for someone sitting on the couch that never knew about Doctors with Borders. But there's one piece that was missing.
Without?
Doctors Without Borders.
Without borders, no borders. Yes.
I have this big border in front of me with Doctors Without Borders, and I read it. I'm dyslexia for the moment. But here's the question.
Yes, sir.
And looking at the picture that you drew us, the one thing that's missing with Doctors Without Borders, is it all male or are there female
Oh,
included?
yes.
Ah,
Oh, yes. Oh,
okay.
females are very important. Females they bring lots of, how do I say it? Positive qualities because they see things differently, you know. And speaking of females, my wife is a nurse and actually helps me and my children to package medications. And when we went to Nigeria, for example, interesting you bring that up, besides the medical surgical care, she noticed that some people, we give medications and stuff, but she noticed that they were hungry, no food.
Yeah.
I didn't pay attention to that. I had overlooked that. So she noticed that she would buy food or give them money for that. And because of that, when we came back here, she went back to school to study masters in social work, to learn more about sociology and social work so that then we can address the social needs of people, not just their medical and surgical needs. So women, very important. And even children, important. And my kids, I'm indoctrinating them early because that's why we're here. You know, we're to serve people. That's how God blesses people, is through us.
Yes.
You know, he's not going to come down to, if he comes again, it's time for us to go, right? So for now, he's been here and gone. We have to keep sharing his blessings with people.
Amen.
Yes, women are important, girls, boys, everybody, preachers. Even I had some disabled people come on mission with me locally. And I have a good friend who is disabled, but he has his own foundation, Tunde and Friends Foundation. And he ministers to people, disabled people. And it's awesome, you know, it's just powerful.
What are the types of surgeries that you execute? Could you give us a brief or an elaborate description according to how you feel?
Yeah.
What do you work on? What do you work with?
Okay, so me, I'm a general surgeon and I also do thoracic surgery. So from here to here, basically, from the neck to the groin, that's inside, that's what I do. But it's not just me. So for general surgery, I take out thyroids, for example. People have goiters, parathyroids, like we talked about breast and breast cancer, hernias, colon cancer, gallbladder, appendix, things like that. Now, I also go with other specialties. It's not just me, there's a group. So we have orthopedic surgeons, you know, that take care of the bones. We have even neurosurgeon. A good friend of mine lives in Tennessee, has done some beautiful work in neurosurgery, which I didn't think he would do, but we were able to do it in Nigeria. People with little kids with hydrocephalus, you know, with water in the brain, we have to put a shunt. People with disc bulging, he was able to fix. And then we go with urologists. As a man, you know, our prostate gets larger as we get older, so it becomes a problem, and the urologists are able to take care of it. We go with gynecologists that do take out fibroids in women, you know, with fibroids, even plastic surgery. They do cleft lip, you know, cleft palate in little kids, burns. So all specialties, those are, you know, whoever we can get. I forgot, sorry, eyes, ophthalmology. Eyes is a big one. Cataracts, simple cataracts is the leading cause of blindness worldwide. In the US is diabetes, but worldwide is cataracts. So it's a huge need. So, and this is, if you go with the right equipment, it's a less than half an hour operation and you give somebody the vision, you know, the gift of vision, change their life forever.
Approximately how many days are you there? And about how many surgeries do you complete while you're there?
So we go at least minimum of a week when we go. I tend to stay for about 2 weeks personally, because I go a little bit before the team, then we'll do the mission for the 7 days, and then I stay afterwards, make sure things are okay, and then we'll come back. And typically when we go, the largest mission we had was in 2019, and we saw over 5,000 patients.
Oh.
And we did 120 operations in a week.
What a blessing. Oh, yeah, Lord, what a blessing.
It's just, and each of those lives you've changed for the better. Yes. And then knowledge
God does put angels on earth, Dr. Eke.
Oh,
He
Well,
does?
we're like I said, we're all blessed, and
Yes.
God gave me the opportunity to be here. I came here from Nigeria at the age of 17
Uh-huh.
as a freshman in college, at Baylor University in Texas. Finished. I was an F1 student. I didn't have too much money. Like I said, my parents were ministers.
Yes.
So they're not rich, not like the ministers today that make
No.
the TV evangelists,
Yeah.
So God has blessed me through people, and that's why I'm so passionate about blessing others too, and
Amen.
hopefully leaving a legacy. In the future, I would like to, I'm actually working on building a hospital there by God's grace.
Good.
We acquired the land, and we're trying to see how we can get something. It doesn't have to be too big, but very
Yes.
efficient. Something like a Kaiser here. Can you imagine?
Yes.
Like we have.
Yes.
Oh, yes, yes.
Exactly.
Yeah, I would say this. When I first met Kaiser, I think I was 7 years old. When I first met Kaiser, it was a little, it was like a little building on D Street in San Bernardino. And then I'm in college and I'm reading a book and it says Kaiser, and it's showing all the places where Kaiser is. And I'm saying, wow, a big corporation. So yes, that dream that you have can become a reality.
Thank you.
Now, I want to ask another question. This is it's going to seem like it's off the book, but it's not. It's really on the book. You've been talking about how well how well Doctors Without Borders take care of people. Now, I want to ask, how well are you taking care of when you're there? And here's if you can kind of dial in on, do you eat well while you're there? Is the food good?
Good question. I see he likes food, Erlinda.
Yes, he does. And you know what? He's been to Africa.
Oh,
several
yeah.
times.
Great.
Yes.
Good.
Yes.
So we're taken care of, yes. And that's why it's important to have a local partner, who knows the terrain. Sometimes our local partner is actually the government. And they provide us security. They provide us with housing and then food.
Amen.
And depends where you go. Every night or every other night, they have some kind of special banquet. Where they just treat us. I know who went to Guatemala. Oh man, I got tired of eating so much.
I would have loved to be there in
Yes.
Guatemala.
So the people are very appreciative and they are very giving,
Yes.
Yes, so they do take care of us. Even in Nigeria, sometimes I take care of patients. They are so grateful. In a week or so, they are all better. They bring me chickens and, corn and all kinds of things just to say thank you.
Yes.
It is nice.
Yeah. That's wonderful.
We are going to have him back again. I mean, because I know there's more.
We're going to have a part 2, Morris. You know that. Yes. Dr. Eke, we are so proud of you. We just, like I keep saying, God put some angels on earth, and you are one of them. And so are you, Morris, because you do some great things as well. Preaching now. I've known him for many years, Dr. Eke, and now he's preaching.
Excellent.
From the prison to the church.
Amazing.
Yes. Wonderful. Wonderful.
Yes.
Thank you all for what you do.
The best thing that's happened to you while working with Doctors Without Borders, what has been the best thing that's happened to you?
Oh, too many blessings. Let me put it that way.
Okay.
Because, I'll give you an example. One of my mentors, he didn't know he was my mentor. Growing up in my village, there was no doctors in my village. I did not see a doctor till I was 16, when I was off in boarding school in the city. So when we were sick as children, this man would take care of us. And you pay him, if the bill is $100, for example, if you have 50, he will take. Whatever you pay him, he will take. So I wanted to, and everybody respected him because he helped the community.
Sure.
So growing up, I wanted to be like him. I said, I want to be a doctor. That's how I got the idea when I was about 5 or 6.
Wow.
So then when I finished medical school, I went home, started doing this mission. I went to him and told him. So he helps me. Until about 10 years ago, I went back to go see him and say, hey, we're going to have the mission in a couple of days. Let's plan. And he was in bed, laying down, very sick, very weak. So I asked him, what's going on? He told me, oh, he had his appendix removed. He removed a month ago,
Oh,
but that he still is feeling weak. And I said, wow, that's unusual. If I take out
Yeah.
somebody's appendix, within
yes.
5 days or so, they're fine. They go home the same day and they
Right.
do well. He was 65 then. So I said, something doesn't feel right. Do you mind if I examine you? Of course, he allowed me to examine him. So I pushed on his belly and I felt a lump on the right side of his belly. And I told him, I said, sir, I don't like what I'm feeling. Remember, I don't have a colonoscopy. Here, I would have done a colonoscopy.
Right.
Or I would have done a CAT scan. I don't have any of that. So I'm going with the history and my physical exam. This is part of the blessings too. It makes me to be a better doctor, to use my brain, not just tests. So based on my training and experience, I told him, you may have colon cancer and we need to take it out. In fact, I'm going to postpone my mission. We're not going to start in 2 days till I take care of you.
Oh,
Because I don't have a hospital there. I went to the city, called a friend of mine there and told him what's going on. Long story short, I went out there and did the surgery with my friend who is also a surgeon. And he had a colon cancer that had gone to the liver. There was a spot in the liver. So we took out the part of his colon, his right colon, and luckily the spot in the liver wasn't too big. So I was able to do partial liver resection, got it out. He's still alive today.
hallelujah.
That is, you see, that is joy. I mean, when I go home, that he's so, he was about to die, he would have died.
Oh, he would
He's
have.
alive today. To God's glory.
Oh, hallelujah. And, it's a beautiful gift to have Doctors Without Borders and have a person like yourself involved like that. I mean, it's a treasure. It's a gift from God. Thank you so much. Thank you. Please keep doing, never stop until you build your hospital.
Thank you.
Then when you build one, build a chain of them.
There you go. That's the goal.
All right. So
That's the
build a
goal.
chain in Nigeria.
Yes.
Because we want our families, our loved ones there
Thank you.
to be well.
Amen.
Thank you, Dr. Eke, for
Thank
being
you.
here. Morris,
And thank
any
you all
last
for telling
words?
our stories. Thank you all for telling our stories. We have to tell our stories.
Yes.
I appreciate people like you that can tell our stories right, not
Yeah.
somebody else telling it, if you know what I mean.
No. And I want you to say one more thing
Yes.
about telling people to go get vaccinated. One more time.
Okay, please, everybody. COVID is a reality. COVID-19 is a reality and it's killing people. In fact, right now in our hospital, I told you I worked last night. That's why I'm still in my scrub. Most people in the ICU, guess who? Unvaccinated.
Oh,
They didn't get their vaccine. So even if you get a vaccine, there's maybe a 5% chance you can get COVID, but if you get it, it's mild and you won't end up in the ICU. And this thing is killing our people, Hispanics and Black folks.
yes.
And people
Yes.
with other comorbidities. So please, I'm pleading to you people, the vaccine is safe. I've had it, Erlinda has had it, Morris has had it.
Yes.
And here we are talking.
Yes.
And then, and if we don't take care of it, we can't get back to life as normal. And when you do it, you're protecting not just yourself, you're protecting your family and your community.
Yes.
I think it's a patriotic act to do it.
Absolutely.
Actually, not doing it is non-patriotic, is the way I think. Okay. And in the past, things like polio wouldn't have been eradicated without the vaccine.
Yes.
Smallpox, all these things,
Right.
pandemics in the past. Let's do our part. Don't believe all these theories that people are looking for you. They're gonna no such thing. And by the way, people track you already. If you have any smartphone,
You've already been tracked.
Okay, Google knows where you are.
You've already been tracked. There's a number on you.
So, but please get your vaccine and let's protect ourselves, please. That's my last plea. And I've lost people, and I've taken care of COVID patients. I still do, and it is scary. Our healthcare system is actually stretched to the brink. Nurses working overtime, doctors working overtime. So if you get your vaccine, you will not just help yourself, help the community, you also help us. And then we can take care of people that need to be taken care of besides COVID.
Thank you. Thank you so much for being such a wonderful leader in Doctors Without Borders. And we treasure your work. Thank you.
Okay.
Thank you.
All right.
Thank you very much.
Morris, would you like to close the program?
I'd like to say thank you, Dr. Eke, and I give thanks to the team, to everyone that is involved and supports Doctors Without Borders. I'd like to say thank you to our audience for listening, for giving a hear, and for being a participant from a distance and from far, knowing that there is a bridge to health. And it starts here, it starts in the heart, it reaches out to the farthest places on the earth. And I just want to say thank you, all of you, and hope that you feel empowered as you heard all of these empowering voices today.
All right. Thank you, Morris. Thank you, Dr. Eke. Blessings to all until we meet again.